Bloomberg Audio Studios. Podcasts, radio, news.
In his first hours in office, President Trump signed an executive order to withdraw the U.S. from the World Health Organization.
So we paid $500 million to World Health when I was here, and I terminated it. China, with 1.4 billion people, they were paying $39 million, we were paying $500 million. It seemed a little unfair to me.
The WHO has called on Trump to reconsider the order. The loss of its top donor could put its work on Ebola, HIV, and Marburg at risk.
For over 7 decades, WHO and the United States of America have saved countless lives and protected Americans and all people from health threats. We hope the United States will reconsider.
On today's episode of the Next Africa podcast, we'll ask what this could mean for disease prevention in Africa, how health agencies have reacted, and who else might now step in. I'm Jennifer Zabasajja, and this is the Next Africa podcast, bringing you one story each week from the continent, driving the future of global growth with the context only Bloomberg can provide. Joining us this week is Bloomberg's healthcare and consumer reporter, Janice Kew, who is based here in Johannesburg with us. Janice, thanks as always for coming on.
Thank you. It's been a bit of a week.
I know, right? And we're just getting started with the new administration. Let's start with the basics here, because many people are probably aware of what the WHO was or became aware of the organization during the COVID pandemic. But maybe you can spell out exactly what it is that this organization does.
It's a watchdog, an advice giver, and a hands-on-type organization. That is, it works to contain diseases like the recent Mpox, polio, and Marburg virus outbreaks. It also categorizes the risk of the spread of diseases, and that helps it coordinate global efforts in combating these diseases. It organizes programs, setting global standards and developing guidelines. So it performs a lot of functions and really pulls together efforts and funding for global health security.
And when we zero in on Africa then, Janice, how does their work get a bit more targeted?
So Africa has spawned some of humanity's most devastating diseases, yellow fever, HIV, Ebola, Lassa among them. And yet the continent has some of the lowest health spending and fewest resources. The WHO has focused its work on both strengthening health systems to cope with climate-related changes in the spread of old diseases like malaria, and also prepare as best as possible for emerging pathogens. With so many competing demands in Africa, it's hard to single out a single focus, but certainly some of the biggest disease killers in Africa since the WHO was formed in 1948 have been malaria, TB, HIV, and diarrhea illnesses such as cholera. So those are big focus points even today.
And we had you on a few months ago, Janice, speaking about Mpox. When you mentioned a few of the other diseases that have sort of proliferated on the continent, what is at risk here if funding is pulled from the WHO, especially on the continent?
Well, other than the millions of Africans who will suffer and die, which really can't be underestimated, there is a risk of mutated variants that scientists then have to scramble to understand. And in some cases, these variants may not respond to vaccines and other interventions. So that's a big risk. And of course, the very real risk of global spread. Even in remote areas in the Congo, people do business and then they return home to various parts of the world, and spread is real.
So then it again, as we talk about quite a bit with diseases, diseases know no borders, right? So when you talk about globally, this could, if we do see the U.S. actually follow through on this plan to leave the WHO, this could become a global issue.
Absolutely. The US is the WHO's main source of funding, so the impact will be huge. To put that into context, if we look at the excitement in 1980 when smallpox was eradicated, it had taken immense coordinated efforts globally and funding. So finally ridding the world of something like HIV is also possible. But as Helen E. Clark, who chairs the Lancet Advisory Board on Health and Climate Change, said in a panel in Davos, it will take prioritization, political will, hard cash, and of course dealing with equity issues. So without that funding, it doesn't work.
Stick with us, Janice. When we come back, we're going to talk about what the reaction has been since we did hear this announcement from President Trump, and who, if anyone, could actually step in to fill the shortfall. We'll be right back. Welcome back. Today on the podcast, we're talking about President Trump's decision to withdraw the U.S. from the World Health Organization. Janice Kew, our healthcare and consumer reporter, is still with us. So, Janice, it's only been a few days, as we were mentioning earlier in the podcast, but there has been quite a bit of reaction to the news this week. Have we heard from the WHO? What have some of these organizations been saying?
The WHO certainly did put out a statement, and it is a serious concern. We have also heard from governments in Africa. Zimbabwe's finance minister says he sees $200 million of US funding at stake after the decision. There will likely be spillover implications for the US president's emergency plan for AIDS relief, known as PEPFAR. And this program, started 20 years ago by then President George W. Bush, has arguably been one of the most impactful programs the US has had and is relied upon in at least 7 countries, probably 9 actually, in Africa. These are serious concerns.
And so then you were mentioning the funding earlier. The US, from what we know, provides just over $1 billion in funding. Are there other countries that are just as significant in terms of plugging the funding gap?
As things stand, there aren't countries that come anywhere close to that level of funding, but we have seen interest from China in helping fill the gap and other Asian and Middle Eastern countries who will likely step up. It's worth noting that this will also probably increase their influence on global health, and that is something that I would imagine many in DC are still weighing up and need to consider.
What do you mean by that, Janice? I mean, the influence of global health, what does that actually look like?
So some funding goes to the WHO in a broad context that helps pay staff who work at the WHO, etc. But some funding goes very specifically to certain programs. And if you've got a country like China who are giving that funding, some of that funding could be directed to specific programs. And that obviously just changes the influence. Also, when we look at a continent like Africa, when you've got, to step away from health for a minute, but when you've got China building the roads that lead to the mines, that infrastructure is crucial to many, many countries. And China then gets access to the raw materials. It can be similar in health. When things are directed very specifically to certain programs, it can change the influence.
If we do see President Trump sticking with this promise, would it have an effect on the other health agencies on the continent, like the Africa CDC?
It definitely would. The extent to which it affects them would have to still be seen. I would imagine that if President Trump is looking internally more and is less generous with global issues, he will probably pull funding for a variety of things, and the WHO could then be just the start. As I mentioned, PEPFAR, I mean, that is an incredibly important program throughout Africa, and it is directly linked to the US and the US president. And so, you know, if he came out and pulled that, it would have a big impact on other organizations like Africa CDC. If they need to divert funding from things they're already using it for because they need to plug other gaps. As we've discussed, there are so many competing needs in Africa. And so if anything, there needs to be more funding, not less.
And is there any hope for a U-turn from Trump? I know we never really know what is coming next. What are your sources telling you?
Well, the speed that he came out with this decision doesn't look particularly promising at this stage. But as you say never, especially with President Trump. So I would like to think that ultimately the risks to global health security surely have to be taken seriously. And those conversations hopefully will happen.
And finally, Janice, as we were mentioning, Mpox was a wide concern last year when we were talking about, diseases in healthcare on the continent. What is the focus now for you, especially now that we're talking about this news coming from the U.S. potentially? I mean, what's the focus of the healthcare industry, I guess, here on the continent?
So this year in Africa, certainly Mpox continues to be a big issue. Rates of spread of that disease have not really dropped, and getting vaccines into arms is still a big issue, especially for children. There are obviously other diseases across the continent that are concerning. We've recently seen an outbreak of Marburg in Tanzania. This bleeding fever is got a high fatality rate and can spread quite easily. Healthcare officials often being at the forefront of the risk as they're trying to help people. There's also, it's been a long time coming, but climate change is a big issue in Africa. Arguably, Africa is the hardest hit and the least responsible for climate change, and disease spread changes as the globe warms up. So we see floods, we see droughts in areas that previously didn't have these problems. And with that comes the risk of the spread of cholera and mosquito-borne diseases like malaria and even dengue. These are real problems, and if anything, they need increased funding.
Janice, thanks as always for joining us and for your reporting. And you can read all of our coverage across Bloomberg platforms now. Here's some of the other stories we've been following across the region this week. Africa's biggest crude producer, Nigeria, has emerged from a years-long output slump due to improved security, creating a quandary for the government. Stretched public finances badly need the extra revenue that would come from higher oil exports, but the country is also under pressure to adhere to OPEC plus production limits that have helped keep global crude prices above $70 a barrel. Analysts predict further growth in Nigeria's output this year and a possible showdown with OPEC plus over the country's quota. And Angola plans to sell stakes in its biggest telecommunications company, Unitel SA, and 2 lenders in the coming months to attract investors. That's according to the Minister of State for Economic Coordination, José de Lima Massano. Massano made the announcement during an interview with Bloomberg at the World Economic Forum in Davos late Tuesday. Africa's third largest oil producer will also dispose of stakes in Banco de Fomento Angola, its second largest lender, and Standard Bank Group's local unit, he told us. And you can follow these stories across Bloomberg, including the Next Africa newsletter. We'll put a link to that in our show notes. This program was produced by Adrian Bradley. Don't forget to follow and review this show wherever you usually get your podcasts. I'm Jennifer Zabasajja. Thanks as always for listening. We'll see you next time.